Hello, I'm Mabel Jong, and you're watching continuing coverage of the World Healthcare Congress here in Washington, D.C. And next to me is Dr. Robert Pearl, CEO of the Permanente Medical Group. And I'm so pleased to be able to check in with you every year, Dr. Pearl, because you really know some of the issues that are happening in our healthcare system today. What are you encouraged by, and what are some of the challenges you believe we still need to focus on?
Thanks, Mabel. It's nice to be here and see you again this year. As I said in my panel this morning, American healthcare has had three big issues. Number one, coverage. Number two, cost. And number three, quality. The Affordable Care Act went a long way towards addressing the coverage issue. As you know, we're at the lowest level of uninsurance, probably in the history of the United States. It did that in a variety of ways: expansion of Medicaid to 150% of poverty level. It did that through the exchanges and the subsidies, and it did that by eliminating people's being excluded based on pre-existing conditions, the so-called guaranteed issue, and the mandate. All four pieces together. It's not fully done, but it's a long way towards that, and we're seeing some great results, particularly as we had added dollars for primary care physicians, and we've seen great access and quality and prevention. The two other parts, though, I think are the really more problematic ones for the United States today, which is what we do with the cost. We know that it's now 18% of gross domestic product. It's going up more rapidly than gross domestic product. And number two, we know that the federal government spends as much as half of its tax collection revenue on healthcare. And so and with the baby boomers coming, that will become even more so. So we know there's going to be downward pressure on costs. The question is, how is the American system going to respond? And similarly, we know that the United States ranks in the bottom half of industrialized nations specific to quality outcomes. Okay. So those pieces together, I think in the Affordable Care Act, there's a variety of pieces that will help to address it. I think the exchanges will lower barriers to switching, greater transparency of data, and they're going to involve people having more out-of-pocket expense for which they're going to be shopping to see what's available. Accountable care organizations, collaboration, coordination of care. We're looking through the Medicare stars, the ability to reward those who perform the best, and to do so at a price that is no higher. And then the high-tech legislation around meaningful use, getting computers. So we have all the pieces in place. The interesting part, we'll see the evolution of this over the next decade.
Well, you cited some pretty dramatic numbers. Haven't we seen a shift yet in some of those numbers, an improvement in some of the data that says the work is working, we're bringing some of the costs down, or not?
Well, certainly at the Medicare Advantage level, we've seen that significant reduction in costs that the government has been able to take out of the system so far without any significant negative impact on individuals, probably spurred by the Medicare stars. So that to me is the really interesting part. If you only put pressure downward on price, sometimes you see erosion in quality and service.
Okay.
If you only reinforce people for quality and service, you sometimes see elevation. What we're seeing in the Medicare stars, which I think is a very, very effective program, is the combination of these two coming together. The overall commercial has, I think, not been quite as successful in terms of the cost side. I think we're seeing the improvements in quality. Cost is going to be the next big frontier.
Well, it seems that there's a lot of emphasis on the consumer now being empowered to lead the charge in bringing some of that cost down. Are you as confident as others may be about that?
So it's interesting. This is probably the fifth or sixth person I've spoken to, I'll say in quotes from the media, you're not quite the media, Mabel, but a little bit. Everyone asks me now about that, and I spoke about that a little bit. I think we are now, as a nation, as a world, in an era where people want more control. If you're going to book a flight, you don't go to a travel agent, you go online and book it. If you want to order a new dress at 2 a.m., you go online and you order it. If you want to get a book and it's Saturday, you order it and have it delivered on Monday. So that ability to control all of that, I think patients now are going to want to do. To this point in history, insurance companies, hospitals, and doctors decided, I always close my office at 5 o'clock. You come on a Friday night to a hospital, you may not get a non-emergent care until Monday. The insurance company said, here are the products. And now patients are saying, wait a second, it's my money.
Right.
And now I want to control that. I think that is now escalating rapidly. It's starting at a low point. because patients have not been, in quotes, consumers. They picked a doctor, they picked the hospital, and they were done. Now they actually want to know all along the way.
Are we perhaps putting a little bit too much faith in the background of some of these consumers to know what they're doing?
Well, no.
Are they asking the right questions, perhaps? I mean, that's a skill set unto its own.
They're going to have to learn, because do you know the right questions when you started to use airline purchasing online? But as an example, in Kaiser Permanente, where I'm the CEO, you call up and you have a medical problem. I'm like, not me, but the person answering the phone is likely to say, Mabel, based upon what the physicians have told me, you need health care. Would you like to come in person? Would you like to come in, would you like to do a video visit or a telephone visit? And by the way, what day would you like to come in? Because we will flex our schedule around you. And by the way, we can see you in the evening and a weekend too, if that's what you want. What do you want? There's nowhere in the world more knowledgeable about what you want. Number two, you start to come in for care, and now people are going to say, okay, let me tell you the different ways it can get done. So there's an education that has to happen within it. I think it's a misconception to believe that the old system worked, because how did you know if your doctor was any good? How did you know if the hospital was any good? Do you know how many procedures they did last year if you needed your hip replaced? It's all word of mouth. And I think that that can be manipulated, whereas I think now we're in a data-driven world where patients go look at those numbers, they're going to check the Medicare Stars rating, they're going to check the consumer reports, they're probably going to check Yelp, by the way.
Yes.
And they're going to put it all together in a way that they never could before. And that's the modern era of technology.
And that, you believe, in the end, will bring down costs?
Well, first, I think that will happen. But I described it, I think it will happen because it's happened in every other industry. I think costs will come down as part of that process because people will start to do some shopping. Take an example. You have a $2,500 deductible, and you see me and I tell you you need a CT scan. Well, what we've done in the past, you say, where do you send your patients? And now you can say, wait a second, let me go on Google. Let me go to some other online source. Oh, it varies from $250 to $1,000 for exactly the same scan. These are exactly the same scan. I wonder if I call the hospital and I say, I'll come in anytime you want me across the weekend. Can I get it for $125?
So you believe there's going to be negotiating power?
Absolutely.
With this?
The only reason people don't negotiate is because they don't have the information. As soon as you have the blue book information on your cars, think about car purchasing. You went in years ago, and whatever it was, we took $2,000 off the sticker price. Oh yeah, okay, what was this? Oh, I don't know. So now what you do is you go online and you look at that, and now you send out to all the car companies, I'm willing to pay $25,000 for this particular car. Who will sell it to me for that? And pretty soon you got a couple of people, yeah, it's going to be no different. Not in year one. Everyone's a little nervous. I don't want to be a problem. No, but ultimately, and that's the piece I say people about healthcare. It's not going to change in 1, 2, or 3 years. It's 18% of the world's largest gross domestic product. If it was a nation unto itself, it would be the 5th largest nation in the world. We spend more in America on healthcare than France spends on everything, including truffles and wine. Healthcare is so big. But over time, it's going to change, absolutely.
So look into your crystal ball. The theme for next year, do you think, will be?
I think the theme, sometime in the next 3 years, I have to, when does it really show window in healthcare? Yeah, it's going to be the application of mobile and other technologies to healthcare. Mobile, video, it's going to be the opportunities that come through them. It's also going to be the regulations around them. It's also going to be the payment mechanisms. So if we say that this is something that has to happen, and now you start to say, okay, well, it will happen, but what are the barriers? And what you're going to find is that doctors could do video with just as good a result, not for every problem, but for a lot of problems, but they don't get paid. That's a problem.
Right. Right.
But we should solve that problem rather than saying video is not going to work. Or you have regulators. All the rules on video were written in the 1970s, before we had cell phones, before we had video, before we had Skype.
Right.
So all of that's going to change. But yeah, I'm a big believer that technology, particularly mobile, video, digital, will be tools to allow us to eliminate distance and space. Can we go across states? Will we at some point go across the world? There's some very good doctors elsewhere in the world.
Yeah,
They would
sure.
love to provide care.
Sure.
Maybe at a much lower price, with excellent quality and far greater convenience. Middle of the night here, it's the middle of the day in
Over
a lot
there.
of parts of the world.
Absolutely.
Yeah, this I think is going to be the horizon. Whether it's next year's session or 2 years or 3 years, I don't know. But I think it really will be something we're going to have to grapple with, and everyone's going to have to change. Doctors, hospitals, insurance companies, and patients.
Consumers.
Yeah, they'll have to change, but they're going to welcome with open arms. I don't know anyone who would give up the conveniences they have today through technology. I don't know anyone who is not going to enjoy just as much the healthcare. Some people still like going to the store,
Sure.
seeing the stuff and touching the stuff, right? Most of you want to buy it online. Some will still want to go to the doctor's office. So it's not one solution. It's, again, this empowerment of the patient who now can say, I will tell you how I want my care. You can tell me your expertise, but I'll tell you how I want to receive it, and I expect that you're going to do it in a very, very high quality, convenient, cost-effective way.
All right. Dr. Pearl, we'll check in next year.
Excellent,
See
Mabel.
if you're right. Thank you so much.
Thank you so much.
Thank
Good to see you.
And I'm Mabel Jong. Thanks for watching.